And now to what the Trump administration is calling Operation Warp Speed. It's a massive effort to fast-track the process of getting coronavirus vaccine. CBS 2's Dr. Max Gomez has the story.
In what is thought to be the holy grail of this COVID-19 pandemic, dozens of companies are racing to produce a vaccine that will be safe and effective at preventing the novel coronavirus infection. But coronaviruses have been notoriously difficult to make vaccines against, and we don't know which of the many vaccine approaches will actually work, which is why federal health officials today announced a kind of vaccine Manhattan Project called Operation Warp Speed.
We're in the early phases of a trial, phase 1. When you go into the next phase, we're going to safely and carefully, but as quickly as we possibly can, try and get an answer as to whether it works and is safe. And if so, we're going to start ramping up production with the companies involved. And you do that at risk. In other words, you don't wait until you get an answer before you start manufacturing.
In other words, the government wants all of the potential manufacturers to go ahead and make their vaccines, risking that theirs will be proven safe and effective, and then be prepared to manufacture the millions of doses required. Perhaps the vaccine furthest along in testing comes from the University of Oxford in England. That team says it's already vaccinated hundreds of people with their experimental COVID-19 vaccine and expect trial results in mid-June. At that point, thousands of volunteers will have to be vaccinated to see if they are truly protected and get fewer infections than an unvaccinated control group. That test phase can take many months unless regulators are willing to conditionally approve the vaccine based on preliminary evidence. The university is partnering with UK-based global biopharmaceutical company AstraZeneca to manufacture this vaccine on a large scale. Both groups have agreed to operate on a not-for-profit basis for the duration of the pandemic. Dr. Max Gomez, CBS 2 News.